More and more teenagers going under the knife to slim down. But is surgery for weight loss safe? A bariatric surgeon is going to join us and talk about what parents and teens need to know if they're considering this kind of surgery.
Looking forward to that. Thanks, Phil. Well, this is pretty interesting here. More and more teens are turning to surgery to lose weight. But is this safe? Dr. Alan Wittgrove, he's a specialist from Scripps Memorial Hospital, is joining us with a closer look at this weight loss trend. Good morning. Thanks for being here this morning.
Good morning.
What do you think about this? Young people having this kind of surgery.
Well, it should be done in centers that are experienced enough to take the risk in those individuals. It is significant surgery, and it is in a high-risk group, that is morbidly obese teens.
So how do you know that your teen would be that obese? I mean, what are the signs that you look for? How much weight are we talking about?
Yeah, when we're talking about teenagers, it's very interesting because as we look at obesity in teens, we look at that a little differently than we do in adults because we have to have their age. There's a whole graph that the CDC has put on that, and so at a certain level, they're at higher risk. But what we're talking about here is the extreme. So these are teenagers who are morbidly obese, even at adult standards.
So the trend for surgery is because more and more kids are morbidly obese. Is that why the trend is going up for them to use surgery?
That's true. And we know from studying this, there's nutritional surveys that we've been doing in the United States for 40 years, and middle school teachers have been doing it for almost the same number, and they can tell you the same data, that our kids are getting more and more obese. And as they get to a third of our kids now are obese, and so more of them become supersized or morbidly obese, and therefore surgery is indicated.
Okay, so there's a couple of different types of surgery now. There's something called a lap band that people are using to temporarily close off. What are your thoughts on that? Is that a safe procedure?
Well, there are really two different options. One's a gastric bypass, and that's been done for 40 years, and we have a long series actually of teenagers, and they've done extremely well with a gastric bypass.
And that's approved?
That's approved.
Okay.
That's a standard operation that's done. And
now
then the lap band, the lap band is a procedure that's been FDA approved for adults for the past 5 years or so. And it would be off-label to do it in teenagers. But it's being done in some centers as studies to look at how that will affect the teenagers in the long term.
Because that can be removed. It's a temporary device, is it not?
Well, every disease, you have to consider what the disease is. And morbid obesity is a chronic disease, so it takes chronic treatment. So even though the band is adjustable and it can be reversible, it should be always looked at as
a last resort. Bottom line, what parents need to do is to take action early so your child doesn't end up in that category.
They really do, and we all need to look at this as a society to treat obesity earlier rather than letting it get to that stage.
Get your kids active, keep them out of those fast food places.
Activity is very important.
All right. Thank you so much, Dr. Whitgrove. Appreciate it very much.
All right, thank you.
Now it's time to check in with Rod Luck. He's in Mira Mesa this morning. Hi, Rod.